Hello friends, in this quick short video I'm going to discuss two types of diabetes that are most common, type 1 and type 2. So type 1, we start by type 1. That's the diabetes that occurs mostly in young people, and usually is due to destruction of beta cells in the pancreas, which is this picture here. This is your pancreas here, and the pancreas has beta cells that produce insulin. So beta cells produce insulin, and in type 1, which is here, you have a condition in which is an autoimmune disease, which means the body's host body makes basically attacks the beta cells of the pancreas. So by doing that, the person is unable to produce insulin. That's why they get high sugar in their blood. Therefore, the main or the only treatment for type 1 is to inject insulin for the patient. Inject insulin. Now, type 2 diabetes occurs mostly in older people, usually older than 40 years old, but it can happen in younger people as well. And that's the problem with type 2 diabetes, is not condition of beta cell destruction, rather is a problem with the body not being able to respond to insulin. Like the cells become, they lose their sensitivity to insulin. So when the insulin is produced by pancreas, the cell, for example, is not responding. They lose their sensitivity, and therefore the patient either needs higher doses of insulin, but before that they can also prescribe to the patient different types of diabetic medication that either stimulate more insulin production as well as increase the sensitivity to the insulin that is present. And there are different types of drugs that use for this condition. The very older one is class of biguanides. This is a class of drug, which the most famous one is metformin. And then there are other classes of drugs that they use for this condition. The most recent one that are all in the news, because they also cause weight loss, and some of them the doctors use for weight loss, such as Ozempic and like Mounjaro. So these are called, the class of these drugs are called GLP-1 or GIP agonist drugs. And these drugs usually work in the gut. There are hormones in the gut called incretins, that these drugs act like that hormone, makes a person not feeling hungry and makes them feel full, so they don't eat much food because they always feel fuller, and they lose weight as well as lower blood sugar because they consume less food. So these are just a brief discussion. There are many more drugs available for type 2 diabetes, and it's out of discussion of this short video, but this was just to recognize what is type 1, what is type 2, and we can go into detail. Please like, share, or subscribe, and let me know if you like for me to continue with the more detailed drug information for type 2 diabetes. Thank you.